I'm Dr.Garima Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic piles or hemorrhoids in English on the demand of few of my non-Hindi patients. So let's talk about what actually piles are. So there are blood vessels present inside the anal canal which act as a cushion which helps in controlling motions. But when these blood vessels get inflamed, it leads to piles or hemorrhoids. So piles or hemorrhoids are the inflamed blood vessels. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe my channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last. At the last, I am going to explain you some of the medicines for curing these piles. So let's talk more about these piles. Now let's talk about its types. So there are two types of piles, that is internal and external. So the internal piles are the piles which are inside the anal canal, and the symptoms of these internal piles are they are painless. There is bright red bleeding along with the stool or after a stool. There may be mucus discharge, there may be itching, and it may get necrosed. Next is external piles. So these come outside the anal canal. The skin tags may remain outside, and these are two painful piles. Internal piles are painless, but these are painful. And these external piles are having dark colored bleeding during or after a stool, and it may lead to anemia too. It gets aggravated during sitting and standing. So there is pain too much during sitting or during standing too. Now let's talk about the degree of piles. So there are 4 degrees. Grade 1, there is no prolapse, there is only prominency. In grade 2, that pile gets prolapsed but reverts back by own. Grade 3, piles get protrude out but it gets reverted back manually. And grade 4, it comes out but never goes back. Now let's talk about the risk factors of these piles. So it is long continued constipation or long continued diarrhea, increased intra-abdominal pressure due to tumor, ascites or any kind of extra internal growth, or pregnancy, any kind of stress or sedentary habits, lack of exercise. These all can lead to these piles. Now let's talk about the diagnosis of these piles. So physical examination is more than sufficient, but anoscopy, sigmoidoscopy or colonoscopy can also be done to visualize these or diagnose these piles. Now let's talk about the management of these piles. So exercising habits, the diet which is rich in fibers and more fluid intake can help in managing these piles. Now let's talk about its homeopathic cause. One of the cured case of mine via homeopathy, and some of the homeopathic medicines which can be helpful in curing these piles. So at first we talk about the homeopathic cause. So there is a let go feeling in the patients that I don't want to let it go. So there is too much straining and constipation, and which can lead to these piles along with the feeling of embarrassment there. Now let's talk about one of my cured case of piles via homeopathy. A patient aged 50 years having these bleeding piles since last 6 months, having sedentary habits since last 25 years, and a very enthusiastic individual, very hard worker, zealous and achiever, and having constipation since last 10 years. Sour irritations were there were nausea and vomiting, unsatisfactory stool, have to go to toilet for 2 to 3 times per day for motions, and very irritable, sensitive to all impressions, oversensitive to loud noise especially. He is a wealthy person, still he feels he is poor. So he works for whole day and night. He hardly sleeps for an hour or two, and rest time he only works, he does his business, only that. So there is a delusion that he is poor. Along with that, he is very quarrelsome. Aorta is there, that is angry when obliged to answer. Too much complaining, criticizing, and fault finding. So the rubric taken at the last is delusion, he is poor, and Naxvamika 200 has been given, and it cured him completely within a period of only 2 months. So at first bleeding stops, later on these piles also gets revert back. As it is a disease of 6 months only, so it cured too fast. So now let's talk about some of the homeopathic medicines which can be helpful in curing these piles. So the first medicine is hemorrhoid. So there is too much difficulty before defecating in this remedy. During the stool there is too much pain inside the anus and rectum, and after stool there is too much burning. It is a very good remedy for bleeding piles. Anus feels sore and raw. Hemorrhoids protrude and there is continuous rawness sensation inside the rectum and anus too. Now the mental generals of the hemorrhoids are: there is tranquil of mind, there is too much irritability, no desire to study or work, and forgetful, especially of the words what he intends to say. So if these symptoms correspond, hemorrhoids can be helpful in curing these piles. Next medicine is brainia. So there is constipation, hard, dry stool as if burnt. There is severe constipation, aching hemorrhoids, and these all get aggravated during hot weather. The mental generals of this brainia is fear of poverty, thoughts of business, talks of business, and there is delirium always of business. And patient doesn't want to talk to anyone because it causes motion, and patient doesn't want to move even a bit. Even the slightest movement causes difficulty in him. It causes irritability in him. And he does nothing and only thinks about business only. So this is all about brainia. If these symptoms correspond, then it can be helpful in curing this hemorrhoids. That's all for today. We'll talk something else in the next video. It's my humble request to you all that kindly don't take any medicine without consulting doctor. So kindly consult the doctor before taking any medicine. The clinic address of mine and the contact number is given in the description link. And kindly don't forget to subscribe my channel and tap the bell icon to get the latest updates of the videos. Stay connected to stay healthy. Thanks for watching.